Hello, I'm Dr. Annie Hassan. I head the Department of Genetics and Molecular Medicine at Kamineni Hospitals. Today I wanted to tell you about the importance of 28th of February in genetics. It is considered as the Rare Disease Awareness Day. There are 7,000 rare diseases in the world and 300 million people suffer from them. Despite this, they are considered as rare or often undiagnosed, making patients and families suffer. We are trying to give you information about some of these rare diseases which occur at different stages of your life. You can see the symptoms of rare diseases while the child is in the uterus, as soon as it is born, as it grows, in an adult, or in later life. Genetic counselors from Kamineni will enlighten you about them. Thank you.
Cardiac disorders can be found in all age groups. Some disorders affect the structure of the heart, some affect the function of the heart, and some affect the blood flow. A change in a single gene can cause heart defects which can be passed down through generations. About 40 to 60% of heart disorders are inherited. Symptoms may vary for different cardiac disorders which include breathlessness, swelling of the legs and feet, and also bloating of the stomach. Depending on the genetic basis, a cardiologist will plan the surveillance, treatment and prevention. In a genetic counseling session, if a family member has been detected with any heart disorder, the other members of the family are advised to undergo screening to check for risk and early onset symptoms which may not show, and also preventive treatment options.
Neurodegenerative disorders. These result in the progressive degeneration and/or death of nerve cells. They affect a person's ability to move, breathe, speak, eat, as well as their mental functioning. These are currently incurable and debilitating conditions with an underlying genetic cause that affects people of varied age groups. Spinocerebellar ataxias, Huntington's, Parkinson's, Alzheimer's are some of the most common examples. Although these disorders are of late onset, the genetic cause for this disorder can be detected using prenatal genetic testing.
Hereditary cancer syndromes are also known as familial cancer syndromes. About 10 to 15% of cancer syndromes are hereditary basis. Breast, ovarian, colorectal, pancreatic, retinoblastoma are some of the examples of hereditary cancer syndromes. All these hereditary syndromes are associated with genetic variation in an autosomal dominant pattern. Genetic counseling provides surveillance, right diagnostic test, and also provides the preventative measures in the families.
Imprinting disorders, which influences neurobehavioral aspects, growth and development. 2 copies of genes are inherited, one from each parent, but disturbances or failure in this causes these conditions. The most common imprinting disorders are Angelman syndrome and Prader-Willi syndrome. Symptoms range from failure to thrive, low birth weight, obesity, unusual laughter, severe speech impairment, etc. Diagnosis of these conditions can be made by a special test called MS-MLPA and MS-PCR, which are essential for early diagnosis and appropriate management for the child to lead a normal life.
Diabetes is mainly categorized into 3 types. Juvenile diabetes affecting less than 14 years age group, MODY affecting less than 30 years age group, type 2 diabetes affecting more than 30 years age group. Juvenile diabetes is an autoimmune genetic disorder in which pancreas may not produce enough to no amount of insulin. Insulin is the hormone used for the glucose homeostasis. Because of insufficient insulin production, the person may feel thirst, frequent urination, unintentional weight loss, fatigue and weakness and blurry vision. If not treated, the complications may increase to heart failure, neuropathy, nephropathy and vision loss. And the treatment includes targeted testing and clinical exam sequencing.
Rare diseases are not really rare if you are aware. Kamineni Group of Hospitals at all its centers have trained genetic counselors to guide you with the right test, facilitate in the testing, and in close interaction with the treating physicians, help you prevent these disorders from recurrence in all your future generations. Please avail this opportunity.